Hello and good evening. Wait. Hello and good evening. I just want to say welcome tonight to Positively Positive. And for those of you who don't know what Positively Positive, the storytelling show, is about, we have people from every section of the world, the company, the country. We want your stories. People have stories, especially people involved with HIV. And that can be someone directly involved because they might be a long term survivor. It might be someone who's been newly diagnosed. It might be a caregiver. It might be someone like our special guest tonight who's with the Florida Department of Health. It might be an organization, or it just might be someone who wanted to volunteer. It's a matter of you have a story, and if there's an HIV component, if there's something about HIV that is in your life that you want to talk about, and we know there's so many, especially when it comes to how do your meds work? We want a doctor, infectious disease doctor, a dentist. We want a resource person. Can we get the resources to the people? And mostly we want to remove the stigma that still exists. After 40 years, that stigma that still exists, it's mind-boggling. And the more your face of HIV in some way shows, the more you tell stories, the more we continue to show what people look like in everyday life who are just doing the work that they're supposed to do, to care, to love, to give, to feel. It's wonderful. And that's Positively Positive. There's nothing else. There's no one else doing this. There's nothing else like it. And Campbell Health Solutions is the sponsor, and it was his vision and mine. I'd wanted to do this for 20 years. And when I met Ricciardo, I said, that's what I want to do. I want my own talk show. But it's not a talk show, remember. It's a storytelling show. He said, let's go with it. Now we got guests coming in from all over, different walks of life, everything. Then the next thing before we introduce our guest, and I wanted to say that as far as for me, I'm Susan Mintz, or Susan Lee Mintz. Everything you need to know about me is wrapped up on a website. It's wrapped up in my life, having been married to an incredible man, Dr. Jeffrey Mintz, for 25 years. He was bisexual, very promiscuous at a time he shouldn't. And I documented when he got ill in 92 with full-blown AIDS with pneumonia, very, very ill. After his passing in 1994, I spent 15 documented journals. Then 10 years later, I transposed. And then almost 15 years after that, I mean, seriously, a labor of love, I put it in my book, Committed to Love, A Woman's Journey Through Love and Loss. There's a glare because of my overhead light. And then its companion book, as I said, I'm a story writer and a storyteller. And I do real life. I don't make up things. I'm not science fiction. I don't do all this other stuff. I'm not that. I like stories. I like capturing the essence of a person. And in my 24 chapters of my book, Committed to Love, I captured the essence of my 37-year friendship and 25-year marriage to a man 30 years later I still love and will continue to love until the day I die. And it's that purpose that God commissioned me to be a spokesperson for HIV forever. My next book was called And I Held Their Hands with a Hospice Heart. Stories of love, hope, faith. And that's a big part of my life. Those 24 stories of people I met at hospice, in and out of hospice, at the airport. I mean, all over. When I saw a little red heart, I knew, but I was a volunteer with hospice in Boca for 6 years. And I found their stories amazing, just like tonight. When I interview someone or I talk to somebody, it's not even an interview. When I talk to someone, I take notes, because in a year from now, I'm probably going to write a book about the people who I met on Positively Positive, and that would be the name of the book. Positively Positive. What is a great name? So you can go to Susan Mintz, M-I-N-T-Z, SusanMintz.com. It'll be on the screen. And you can go to my books icon page, read all about me, read about the books. They're available on Barnes and Noble or Amazon. I would suggest Amazon. And the 24 chapters. You know, I thought about it today when people line up at Starbucks for their $10 lattes and their donuts and think, you know, the next day, kids, it's not going to look like a donut and a latte. The next 6 years from now, you're going to have a book in your hand that might be saving your life because it's got issues. And so I would suggest you go on my books icon page, and if you want to order them, good. If you don't, just be concerned about the people around you with love, kindness, and respect. Now, after just a brief pause, I am going to introduce our guest, Miss Ashley Vickers with the Department of Health in Falmouth, the Florida Department of Health. Well, hello, my friend, who I feel I've read your bio so many times. I see it in my sleep.
Hello, good
Yes,
evening.
I do. I read it so many times. I want to do something different with you than I've done with previous. You're about, this is tremendous. So you are, say your name, please.
My name is Miss Ashley Vickers.
Love it. And it's so nice to see a face with a name. I know you said we met previously, but if I had my glasses on, I would remember more. But they're going on now. I'm going to ask you a few questions, Ashley Vickers. Your
Okay.
title, the title that you are now wearing with the Florida Department of Health, and I want to stress now,
Mhm.
is the Prevention and Training Consultant, the Division of Epidemiology and Communicable Diseases, HIV prevention. Is that
Yes.
enough? Was that good?
Yes, that was perfect. That that
Okay,
that was that was perfect.
that's that's a lot. I had to
Yes.
literally write this down. Now, from reading your bio, you know how they say blink one for yes and two for no? You don't have to do that. Just, just because if not, you'd be blinking all over the place. Because I got a few things that, to me, summed up everything about you. Number one, you are a woman of great passion. Say yes, don't shake yes. Yes or
Yes.
no?
Yes.
Yes, you agree. Check the box. You are an empowerment person, not just a motivational person, but you're an empowerment person.
Yes.
You very good. You want to improve the well-being. I say you want to improve the well-being in your community.
Yes.
You want to definitely break down stigmas.
Yes.
And this one I loved. This one just gave me the chills. You are a voice for the voiceless.
Yes.
Okay, now your turn. I want to tell our viewers, just me right now. I want you to tell us about where you were born and your journey into where you are now with the Florida Department of Health, your different degrees, the different reasons why. And then in between, I might just, stop for a moment just to have you expound on something a little bit more. But
Okay.
I really want your background and I want the real journey from your roots to that big title that I gave that you gave yourself because you are academically you love it. I admire you already because I was not somebody, I was on the streets wanting information. You're someone who gets it from books and studying, and I admire you.
Thank you.
All right, so tell me where you were born and how you started on your journey.
Okay, good evening once again. My name is Ashley Vickers. I was born in Belglade, Florida, which is a small town about 45 minutes outside of West Palm Beach. So the town is near Lake Okeechobee. We're known for our sugar cane and our football team, and also the soil. Um, I was back and forth from my mom to my grandma, but my grandmother was the one that primarily raised me. So that's where I got my heart for helping people. While I was growing up, I always seen my grandmother giving back to her community, and she will always remind me, Ashley, God will be a blessing upon you if you be a blessing upon others.
Mm.
So that really gave me the passion to do what I do now. Um, when I was in high school, which was Glade Central Community High School, in my junior year, I enrolled in a CNA program. That CNA program would help equip me with the skills to take the CNA test and pass it, which I end up doing that. So before I graduated high school, I ended up obtaining my certified nursing assistant license. So
Is
my
that what a
this
C is? Ashley, is that what a CNA is? Your certified nursing assistant?
yes, ma'am.
Okay, and you got that out of high school?
Yes.
Wow, okay.
Mhm. So
Okay.
that's how I started into healthcare. So I got hired at 17, but I was lucky because a couple of days after I got hired, I turned 18, and that's when they let me start to work. So I end up starting at a nursing home, and my passion really fueled from there because I love the smiles of my residents when I used to help them with like simple things like baths, feeding. Well, what I thought was simple, but it actually meant a lot to them. That really, like, made me ecstatic. Like, I'm like, okay, I'm far away from my grandma because she was back in West Palm and I was in Tallahassee. So I felt like, okay, I'm helping other people, which are like an elderly population. So I'm like, okay, in a sense, this feel like I'm right back at home with my grandma. So I was really happy with
Um,
that. hmm
mm,
So when
it's
I
very
first
rewarding.
started, yes,
It's very rewarding working in a
yes,
situation like that if you have a heart for it. And it teaches you
yes,
so much about the aging process that might affect you down the road. It's
yes.
wonderful. So,
Yes. So my major in college was actually nursing. I started off with nursing, but it was unfortunate because at the nursing home, I did come across coworkers that did not enjoy their job, and primarily it was the nurses. So the nurses would ask me, like, hey, what you're in
mhm.
school for? And I'm like, hey, it's nursing. And they was like, oh no, if I could go back to school, I would choose a different major. So I'm like, oh, okay, you know what? This might not be for me because every time I'm around these nurses, they're so like, down and out. They're complaining about their job. I don't want to be that way. So I end up switching my major to social work. So a few years passed. I end
Mm.
up moving from Tallahassee and I moved back down here to West Palm Beach. So I obtained my associate's degree at Palm Beach State. And while I was trying to research schools for my bachelor's degree, I was trying to still look for social work programs, but online because I'm a full-time mom. I have two kids, Mason and Madison. They're now 8 and 3. And then on top of that, they
Wow.
have autism. So I have to be very hands-on with them. So I wasn't allowed to like go on campus. And then on top of that
And
as
what did you
well,
say they had,
autism. Both of them are autistic.
Ashley? Back, both of them are autistic?
Yes, ma'am.
Wow.
Hmm.
Well, I can see how you do care about people because you've been involved with it. Okay.
Hmm. So I'm like, okay, I can't go on campus. And then also at the time too, I was working at an adult rehabilitation center. So basically, it was like a daycare for adults that were disabled. So I was doing that as well. So I'm like, okay, well, I can't go on campus. So I end up enrolling at Florida International University, but I had to switch my major over to psychology. So I'm like, okay, before I did, I'm like, what major could I switch to that I could still help people, but that will fit my schedule and my kid's schedule and my work schedule. So I end up finding psychology. So I'm like, okay, we're going to switch my major again. And before I got to the health department while I was still working at the rehabilitation center, I was actually pregnant with my daughter at the time. So before I did my interview at the health department, um, I wasn't pregnant. That's what was so funny. I wasn't pregnant.
Oh, yeah, freezing.
Ma'am,
Okay, we're having a little trouble. We're having a little trouble with Ashley speaking now, but we'll keep trying and keep going. Yes, all right.
can you see me
Keep
now?
going now.
Okay. So yeah,
Yes.
initially did my when I initially did my interview for the health department, I was not pregnant at the time. So time passed, and by the time they end up contacting me for the position for ADAP for a record specialist, I was pregnant with my daughter. So I'm like, oh my God, like will they still hire me? And at the time, the supervisor, she said, yes, we'll still hire you. You could come on board. So I was really happy because I'm like, okay, it's like a shift of change. I'm no longer like, really on my feet. And this will be helpful for me because I'm behind the desk. And at the time, I was like 8 months pregnant. So that's how I got into the health department. So, yes. And I started at
But
ADAP,
you
which
have your
stands for, I'm sorry.
you got your degree from you got your bachelor's degree from FIU.
Yes, I received my bachelor's at Florida
That's
International University, and I actually received that
psychology.
this year. Yes, ma'am.
In psychology. So you've really gone through a lot of different venues to get to where you are right now. And that's
Yeah,
what I just want to say. So you went from just a little brief, get all on the same pages now. Your grandmother pretty much taught you about community and taking
yeah,
care of others. And if you do that, they'll take care of you. And
yes,
then you went from there into high school to get a CNA at 17. You
yes,
had a CNA at 17, and then you went into healthcare because you were from nursing and then into social work. So you've transitioned was your need to be with people and care
yes.
for people and take care of people. Actually, are you? And she got that from. Can you hear me, Ashley?
Now I can
Okay.
hear you. Now I
She was
can.
raised pretty. Can you hear me?
Yes,
Okay, then I'm just summing it up. You got your CNA at 17. So you became in the healthcare field from nursing to social work and children on top of everything else. But you end at FIU into psychology, which you end up at the health department 8 months pregnant with your daughter. Now,
Yes.
Ashley, with
Now I can
Ashley
hear
Sheet.
you. Oh,
Okay, then I'm going to, yeah, there you are. Okay. So how then with the health department did you get um, involved? You were 8 months pregnant and you got the job at the health department. How did it come about though with HIV?
Um, how did it come about with HIV is okay. So when I initially did my interview for the previous position I had at the health department, during my interview, the supervisor asked me, did I have experience with people with HIV? And I had told her yes, because some of the clients that I did deal with private duty and at the nursing home, they did have a diagnosis of HIV. So that was the little experience that I had with it, but I really wasn't fully aware of like, the information behind HIV. So thankfully she gave me the opportunity to get the job. And through that position, that's how I learned more about HIV. And that was through ADAP. The position that I have currently, it's actually like a promotion for me. And I've honestly had this position since January.
It's wonderful. How did you find that working with HIV at what level? A test degree in psychology. Tell me about do with your position department find with stigmas with HIV. What do you see? You see this whole thing going from your perspective.
I'm sorry, can you repeat that question one more time? Because the audio was breaking up.
What I wanted to know was when you were doing your HIV training degree in psychology, and I wanted to know how that fit in with HIV and you found um, so interesting your clients, the people that you did some social work, health department position now. It's an involved position. So
Yes.
how did you? What do you come across now in this position that you can bring out and bring forward and tell the people what to do or how to feel, what to say, or where to go?
Okay, so basically, okay, so mental health. That's important. That is key. And I've noticed like how my education tied into my career is that basically, just their well-being. Some people, when they look at someone that's HIV positive, they just see their diagnosis. I don't see that. You're a person to me with feelings, with emotions, with with a heart. So my primary thing is just to treat them with compassion, treat them with respect. Because I notice too, once I do that, I'm able to connect with them better. And then we're on, like, feel like we're on the same level. So they don't look at me just as a healthcare provider, or they don't look at me like, saying that, oh, well, she's going to judge me because my diagnosis. No, you're just a regular person right along with me. Um, to be honest, I honestly feel like through this position, I'm learning so much more about just being a human. Like I sometimes I be feeling like,
It's
oh,
one.
sometimes I feel like I'm just going through so much, but then there's other people in situations that are just living life. I come across when I do presentations, I come across a lot of people that be like, "Oh, well, if they have HIV, that means they have a death sentence. They're on their deathbed." And I'm like, "No, you don't understand that when I come in contact with these people, they make me want to live my life more. They make me see that there's more to life than just a diagnosis. There's more to life than just doctor visits or in medication." So it's just, I don't know, like,
Ashley.
doing my
Yeah,
job.
Ashley, do you
Yes,
think your whole background, stemming from your grandmother, all your background of caring has though and empowering, that you don't see a diagnosis, you see the
yes,
person, you see
yes.
a human being deserves to be of value, respect, and why 40 years later does this stigma exist, and why are you one of the people who's going to help remove it?
I feel like the stigma still exists because people just don't want to face they don't want to face the truth. I feel like a lot of people are very judgmental. So they feel like, oh well, I'm better than this person, or well, this is going on with that person, so they're not worth anything. And I just feel like there's not enough education behind HIV. That's why the stigma is still here. Because a couple of days ago, I did a presentation. Oh, I'm sorry, you could go.
No, I just thought then that's so that I think so much has to do with 40 years later, why it boggles my mind to see that here. We have all of this technology. Then when it comes to education, where is the lack of it that people issues? Honest truth now available that wasn't in the 80s and 90s. Don't get that.
See, that's the thing. It's a good and a bad side about technology because you're able to put anything on the internet nowadays. So it could be lies, it could be, false accusations. Like it could just make HIV seem, like horrible. And that's what I try to teach is that HIV is not a death sentence. There are people living 40, 50, 60 years with HIV. So that's what I really try to teach. A couple of days ago when I did a presentation, the age range of these kids had to be between the ages of 17, I want to say 16 to 18. And they thought like you could catch HIV through mosquito bites, kissing someone, sharing a toilet with someone. And I'm like, no. So I'm so glad that and this was back in my hometown, in my community. So I'm so glad that I'm able to, go out and teach these things that, hey, this is the stigma behind HIV, but this is the truth. And the lady that was there, which was an older lady, she was even amazed now about the medication that is out there for those that are HIV positive. Like she didn't even know that it was a
Yeah.
possibility for a woman to give birth like to a baby, and then within a couple of months that baby does not have HIV. So there was very like amazed with the information that I was giving them. So sad to say, even with the technology, they're
But
still being misinformed.
all right, now I want to ask you a question. Do you think though, do you know in the 80s there was so much more, there was activists. It was true activism, that was a part of everything. Because a couple generations of people had grown up never knowing HIV.
Hmm.
They've never known any past. Never did. So for me, I look at it as I understand why, except I firmly believe that there's going to be a resurgence of to aid vulnerable with the drugs they're doing and the lack of action that they are. I think we're looking at a couple of generations of people who like a freight train. Okay?
The audio is in and out. So I really didn't hear most of that.
What I was saying was that there's a couple generations that have never heard about it, seen
Mhm.
it, right?
Yes. Can you hear me?
But I'm going to let you continue. And the other thing is that it was, yes, it was much more proactive in the 90s. It's not that way now because the medications
Mm-hmm.
have allowed us to know that you live 20. So, because you're educating kids that have never experienced it, but they have the drug issue with promiscuous, thinking you can't get pregnant,
Mm-hmm.
or you're being promiscuous and you're lonely and you're a widow. So it's out there yet.
Mm-hmm.
And I think new generation of people coming down with HIV at this point, don't you think?
Yes. Um, that's why too during my presentations, I also tell them because they also think that HIV is a gay disease. And I have to explain to them the different groups that are affected, like, that are highly affected by HIV, which is Black women, Latino women, the age range between 13 to 24. So I try to tell them, hey, anybody could contract HIV. It's not just a gay disease, but you have to make sure you do your part by staying protected. So I try to let them know that, hey, like, just don't be out here just thinking that, hey, I can't catch HIV because I'm not gay. No, I try to make sure I make that very, like, I explain that to them, make it like very clear that, hey, these are the steps you need to take to make sure you don't contract HIV. But I keep repeating to them, hey, if you somehow was to, like, become HIV positive, please understand that it's not the end of the world.
We are going to keep talking because Ashley was talking about her presentation to some young people in Belgrade, ages 16 to 18, and they didn't have a clue about it. And people, you with me,
Can you?
Ashley?
Yes, I'm still here.
I'm
Can you
in
hear
and
me?
out also. So, with me? There's an action tonight, but we are going to keep going. Ashley,
Yes, can you hear me? Can you see me?
take it away. You know,
You can hear
I
me?
don't know. See, we are going to technology with the feed. What we're doing is
Okay, so just to explain what I do again, I'm the prevention and training consultant for the Palm Beach County Health Department. What I primarily do in the community is I host events. I also help our community partners plan events surrounding HIV awareness and prevention. I also give presentations, and I also help teach HIV 501 courses at the health department. I really do find my job very rewarding. It honestly don't feel like I'm going to work every day because I have such a passion for helping people. I feel like it's deeper than HIV to me. Because mental health is another big, huge aspect of me. So I try to dig deeper into the person I'm helping or the community, and I try to figure out the things that they desperately need. Um, so, like for instance, in Belglade, I have partnered up with Dr. Sandra Anderson, which is our minority AIDS coordinator, and we do gentle fitness classes every Monday for the seniors. So that's very exciting. Hi, Suzanne. Okay, senior.
I swear. Yes, I said, we just flow with it. As I said, we just flow in the spirit with it. Whatever happens, happens. We just keep talking till we hear the music. Sandra is wonderful, and I hope to
I
have her
love
as a guest.
her.
Isn't
I
she?
love
She's
her.
remarkable. She interviewed me at my home several
Mm,
years ago, and on my book and my life and all that, and we're very close. And so she's going to be a guest on our show. And what I want to say is that I am so over glitches and so over all of this stuff. There could be someone tuning in on a microwave right now in my wherever we are. It doesn't matter. It's information. You keep talking until you have nothing more to say, and then you still say what you got to say. That's why it's easy with me. You said you were a little uptight before we started. How do you feel now?
I'm okay. I feel like it's flowing better because it just feels like I'm just having a conversation.
We
What
are. We're
what
telling
makes
a story.
me what makes me like nervous the most is I try to be mindful of the things I say because like I'm still learning. I'm still learning as I go. So I don't want to say anything that might offend anyone. I don't want to use the wrong terminology for certain things. So that's why I was kind of nervous. I'm like, okay, actually, like, don't say anything that will offend someone, but I'm still learning. I'm still learning.
We all
I'm
are. But Ashley, we are all still learning. And that's what's wonderful about this journey we're on. I look at life, like even your life, if we put it into compartments, you started off in Belgrade and your grandmother raised you. And then you went on to take your CNA. And then you went on to get your bachelor's in this. And then it ended up in psychology. And ended up you're like a social worker, psychologist, and HIV person with the health department. I mean, look at how you've grown on your journey. And I'm the same way. I am still wanting to do everything that I can to become better, to learn more. And you sound like from the words you use, are you a woman of faith, great faith, a spiritual woman?
Yes, that's how my grandmother raised me. She raised me to believe that we do have a higher power, and I'm Christian, so we believe in Jesus. We believe in God. So
Yeah,
she
I could
always.
hear that by the words.
Mhm.
The words you were using, I could tell you were probably raised in a very Christian faith based. So, are you
Mhm.
still very passionate in the? Are you still in Belgrade, or where are you then located? Where do you live and where do you work? Is that?
I live in West Palm Beach. I work in West Palm Beach. But at my
Okay.
interview for this position, I told them and I made it very clear. My heart is in Belglade. My heart is in the Glades. I'm going to do whatever I can to help my community. So I'm trying to bring all the resources here. So just a couple of weeks ago, I am so thankful and blessed. Triple H Ministries, we partnered with them and we had an event. That was my first big event. So we had an event in Belglade and it was a community health and wellness event. We did so
Mhm.
well that our event was supposed to be from like I want to say 10 to 2, but we did so well that we ran out of everything by 12 o'clock. And then on top of that, we were able to get people tested for HIV, hepatitis C. So that made me so happy because the stigma behind HIV in that area is
It's
is is bad. So even
very.
when even the condoms, even if they see condoms on the table, oh well, I don't need those, or you could keep them. But just to see that I was able to get people like encouraged to get tested, that made me so happy. It's
Mm-hmm.
been times where Richardo done came out to me and came out with me in the Glades area to do HIV testing at soup kitchens. I even partnered with Monarch, and they actually went to the Glades area to table at a expo. So I try to bring all the resources from over here out there. But that's really my heart, and I didn't understand that my community needed so much help until I moved out my community. And
And
I was
tell
like,
me about
"Yeah."
Triple H. Tell me about Triple H Ministries. What is that?
Okay, so Triple H Ministries is a organization ran by, her name is Miss Caroline Hill, but I think she
Oh,
goes by a different name, Granison, I believe.
yeah, I know
Um,
her.
yeah,
She's a doctor.
I met,
She's great.
yes, I met her through Dr. Sandra.
Mm-hmm.
Those two women together are so powerful. They're
Mm-hmm.
so powerful. It's been many times where they done helped me in my personal life that I just can't thank them enough of. They're really like angels, like really angels. Um, but yes, that well, we call her Doc Caroline. That's what me and Dr. Sandra call her. We call her Doc because she loves helping people. So other than HIV testing, she does give away free food. So she have a
Yeah.
food pantry. So I just love her. She's amazing. Like she's superwoman. She is
We want
superwoman.
her. I want her. I also want her on the show. I go back with Caroline to the days when she was, I can't even remember now, to some church she was involved with years and years ago. And she was always into the food, helping people then. Those are two very, very powerful women, I'd say, in Palm Beach County, including yourself, who are doing so much to
Hmm.
reach out in the community and try to help those, as you said, you're a voice for the voiceless.
Hmm.
Yeah, and that's just so wonderful. The other thing, do you find, and I always like to go back to, and we're seeing triple H ministries.com. How do people reach you before we end? We have plenty of time yet, but how would people personally get to reach you? What is your email address or a website?
My email address is Ashley, ASHLEY dot
Mm-hmm.
Vickers, VICKERS at
Mm-hmm.
flhealth.gov.
At
That's how you
SM, at
F
SM,
no
F, oh, I
flhealth.gov.
see. Oh, I see. flhealth.gov. So it's ashley.vickers at flhealth.gov.
Yes.
That's
And the S
that's
is
on
after the R.
that's great. That's on the screen. And I always want to make sure that people are able to reach our guests. That's just so important. And I
Hmm.
really have to laugh because I just think every interview we've done, though, seriously, actually, has been so great. But there's always been something that's happened that just makes me want to scream. And then I say, I watched MSNBC today when my TV finally came back on. I watched MSNBC today. In the middle of them interviewing someone, the person's, and all of a sudden, well, I think we lost their feed. Yeah, you think you lost their feed? Yeah, me too. So I don't feel badly if Richardo's in one place, you're in one place, we're all in different places, or we're all in the same room. It's gonna happen. And that's what makes us human. And I think that's what makes um, positively positive this show that's none like it in the country or the world because God gave me that commission to speak about HIV and the gift to be able to write, speak. And even though I may not always have looked approachable, doing this is incredible because this will get people to approach myself, but they get to see the face of someone who voluntarily committed to do the work that she
Mhm.
does. And now you have three children?
Oh no, I have two. I have two kids, Madison and
Oh,
Mason.
okay, the two. And how old are they?
My son Mason, he's 8 years old, and my daughter Madison, she's 3.
Oh, so you're new with this, 8 and 3, and then you have a full-time career. Is your grandmother still alive?
No, unfortunately, she passed away of August 17th, 2021.
Would you say she was your mentor and your guiding force into your life?
Yes, yes, most
And
definitely.
Do you find that a lot with the African American community, though, that many times it's the grandmothers who are raising the children?
Yes, yes, I do. I do find that a lot of times that the majority of the households, if it's not single mothers, it's grandparents taking over the role for the parents.
Yeah. So
Yeah,
where do you see HIV in the next couple of years? Because I know a show like this, and with people like you and Sandra and Richardo and all the other amazing guests we're going to have on, we got so many guests in the eaves waiting to come on. I can hardly wait till they get their glitches out of the way. It'll be wonderful. But it was had great. We get great response because we just flow with the flow, go with the flow. But anyway, where do you see in the next year or 5 years or in the future with the medications, other than the drug companies advertising on TV? Where do you see the proactivism, and where do you see it going into the communities again, into the cities again, into the states and all over the country again, this activism? Where do you see HIV going?
I really see HIV coming to an end. I honestly believe, I don't want to say a year from now or like 5 years from now, but I honestly believe in the future there will be a cure for HIV because we have so many brilliant people, scientists coming up with different cures, experimenting, to come up with things that can help other people. If we could find ways to prevent HIV through medication, I think that we could find medication to cure HIV. I
Me too.
strongly, passionately believe that HIV will come to an end. Long as we can fight the stigma, I feel like we can have more people, coming together, even those that are HIV positive and scared to tell their story. I feel like if we can push, them to be encouraged, and we could pour more love and support into them, we could get them to actually come to the forefront and actually talk about their stories and inspire other people to get help. But it's really just the stigma. It's the stigma, and we really have to fight that. So that's what
How
I've
have,
been trying to do.
how have you found the medical community where you are? How are they responsive? What do they do? Do you find that the doctors, you have only a few infectious disease doctors, even though it's Palm Beach County, we should have dozens and hundreds practically. But how do the doctors work with you? How does that work?
To be honest, I really haven't came across a lot of doctors.
Yeah.
Um, the majority of the help that I get or the people that I speak to normally be, community partners. Um, Doctors,
And you would think you would think the infectious disease doctors would truly be on the forefront. Yeah, I think that's it. It may not be the
oh,
music, but something. It's a door. Is that you?
oh, that was me. I'm sorry.
Oh, I thought maybe it was the music going short. But the other thing is, I would think that the doctors themselves would want to be so proactive. They're infectious disease doctors. You're looking at hepatitis. I mean, infectious diseases are all sorts of things. Was COVID an infectious disease? I think the stigma behind HIV, I've said this on every show I've ever been on in the last 20, 30 years, and I've been on a lot of.
I am so sorry. That is me.
Oh, I'm so glad it wasn't me. The man, I'll take the blame for anything at this point. The other thing is, where was I on that one with the doctors? Um, Talk to me, fill me in. I was talking about something with the infectious
Hepatitis
disease
C, we're
doctor.
saying, about the hepatitis C. But I would like to chime in on that. Some doctors, I done had experience where I will go to my OB and she will ask me, what, Ashley, do you want to get tested for anything? And I'll say, sure, can I get tested for HIV? And she would say, oh, well, you shouldn't have to worry about that. What do you mean I shouldn't have to worry about that? I would like to get tested for HIV. And I've done came across a lot of people that done said, when they ask for that testing, their doctors will look at them like, well, why would you want to get tested for HIV? So for the doctors to have, that type of attitude towards their patients when they ask to simply get tested for HIV is sad.
The other thing, the reason the stigma I firmly
Mhm.
believe the stigma is because it's a sexually transmitted disease. Though with COVID, I mean, people wouldn't even going to touch a doorknob. I think that's for me, that's the way it was in the 80s and the 90s, and especially when Jeff was in the hospital. I mean, they were dressed up like in their rubber suits as you saw COVID doctors and nurses. That's the way they treated HIV in the early 90s when Jeff was that ill. And that was frightening, which made me want to write my book and document every detail because I just thought the whole thing was so horrific. You know, I was
Mhm.
married to him and I wasn't going to be positive because we chose to have a celibate relationship for 13 years since I heard about Abe. It didn't stop me from loving him and still loving him, but they treat people like lepers. But I would think the
Mhm.
infectious disease doctors would be much more proactive. But if it wasn't a sexually transmitted disease, you wouldn't have the stigma. Like people are
Mhm.
having sex, how can you deny it? It's just you don't want to talk about it. And the
Like
other
for
thing with
instance, oh, sorry
isn't that
to cut you off, but sorry. For instance, herpes, HSV1. I know they
I
won't make a big deal out of that because they'll be like, "Oh, well, it's just herpes. Almost everybody have it."
I
But when we
have it.
talk about HIV,
Jeffrey gave me that early on. I don't even know when, but I have it. And having had several sexually transmitted diseases from him, I
mm,
knew though those were curable in that respect. You take an antibiotic, I was fine. But when AIDS came along, I knew with his behaviors that I had to be proactive and not
mhm,
allow that virus into me sexually. But it
mhm,
didn't stop us from having intimacy because intimacy and sex don't go together. I mean, and you can be very intimate and never have sex.
mhm,
Intimacy is a whole different thing. But it was just that was a part of it. It's a sexually transmitted disease. And that's how you remove the stigma by talking about sex also. And they
yeah,
stopped talking about that. We used to in the 70s, 80s, and 90s, we had Dr. Ruth, we had people talked about sex openly in their shows and had guests on. Where's that
mhm,
today? People are having it, but why can't we
mhm.
talk about it?
It's very censored. It's even hard to get in the school systems and talk about, HIV or just sex in general. Yeah, they might have, sex ed classes, but I feel like it's censored to what they talk about. Because the
Right.
last time I took a sex ed class was back in middle school, and that was like sixth, seventh grade. And to be honest, what I've learned in my position about sex versus what I've learned in middle school is it was very censored. And
Yeah.
I really feel like, with these kids, they're doing a lot now. I kid you not. I was at I want to say a behavioral center, and the youngest in that class was 13, and she was talking about sex. And I'm just like, okay, they know a lot for their age, so why do we have to censor what we teach them or what we say?
Yeah. Somebody's having it, that's for sure.
Yes,
But
yes, and they're starting off very young.
I mean, as much as you're very optimistic about a cure, you still have to deal with the fact that the drugs are very expensive.
Yes, yes,
It's more beneficial to keep you sick in every kind,
yes,
whether it's
yes,
diabetes or heart disease. Drug companies will not make any money if we stay well, which is why we're a very sick nation because we can pop pills and take tests and do all that. Oh,
mhm,
one of my guests I had on last week, I said to him, why don't we make that a part of our routine physical? You go in and you have your cholesterol checked, your sugar checked, your whites and reds and blood test. You have all that checked, your vitamin D's. You have everything checked once a year.
mhm,
Why don't we just automatically include an HIV test? You're drawing blood. It's no
mhm,
different blood that you're going to have to take. They're
mhm,
taking 4 vials from me all the time for my regular test. So what's another one? So I don't understand why it's not included with our insurance companies, bless their crooked hearts, and other places. It's true, Medicare. I mean, and I'm not going to get personal because I don't want to get blowback from anybody there. I may end up having somebody from the insurance company on this show. But the flip side is, why can't we make it like your breast exams or
mhm,
colonoscopies? It's routine.
mhm. I
And
like you said, I really feel like it's for money. It's money purposes. I feel like greed really runs society today, and they more so care about how much money they can make versus helping people. Because if we
right,
don't have more sick people, that's no more money in their pockets.
yeah.
But it's really unfortunate.
So if I'm going to sum you up, I'm going to say again, a lady who was raised. So I'm not hearing our music, and it seems like our time is almost up. So I want to say, and especially, thank you for you couldn't have been a better guest. You are exactly what we need. It is you are heartwarming, you are compassionate, you are a voice out there that's making a difference. And next time we meet, it'll be in person at some event. Oh, hear it? Wait, did you hear it? That
Yes.
soft melody, that gentle, soft melody.
Yes.
I wanted heavy metal, rock and roll. They said, no, we're going to have soft music playing. So, but to sum you up, I would say you were raised by your grandmother, a woman of great faith,
Yes.
and you are a Christian spiritual woman whose words come across very loving. You also have gone through many degrees, several degrees, several
And I'm
jobs.
currently in school right now. I'm obtaining. I'm right now. I'm at Nova Southeastern University, and I'm in my
Yeah.
master's program, and I'm going for clinical mental health counseling.
Mental health counseling at Nova.
Yes.
Yeah, that was what I saw at the end of your bio that you wanted to now be from social work into psychology into HIV prevention and testing and everything to now you're going for Nova for, let's hear the audience one more time. What? Mental health counseling.
Yes. I want to be a therapist. That's my end goal is to be a therapist.
You are right now, you just may not have the shingle. You're a mental
Mhm.
health therapist. My late husband was a psychologist. You're as good as any, honey. And the other thing I'll always promote is writing. Are you ever writing in journals or documenting or
Yes.
diaries?
Yes, I
Good.
have plenty of journals. I love writing. That's why these papers, I don't mind by doing them because they come as a breeze. But yes, I have journals. Even in my phone, in my notes app, I will keep like my thoughts in there as well. But it's
Isn't
another
it?
thing I would like to say, I always get like, positive feedback or I'll get thanks. Like, people saying, thank you, you're doing an amazing job. But like I would tell people, I honestly, like, some people look for that spotlight. I don't look for it because I honestly felt like I was placed on this world to be a servant, to help
You
out
bet.
others. So
Yeah.
normally, like, normally that stuff kind of make me cringe when I hear that, oh, you're doing amazing. I'd be like, okay, thank you. But this is what I'm supposed to do.
Isn't
That's how it
it?
is.
It's amazing that I always said we don't choose our message. Our
Hmm.
message chooses us.
Hmm.
And you can run away from it. I could effortlessly, 30 years ago, have left my marriage. I mean, or left after he passed, not a token anything about my life, been a bit invisible. But no, those journals became the lifeline to my bond with him forever. I teach writing. I absolutely teach it. I teach writing classes online, or I'll talk to people and sit with them. This journal, these spiral bound notebooks, you don't know. I would tell everybody tonight, get a pen. Do not trust in technology. Please, if you're writing a book, don't trust on technology. Get two pens and a
Hmm.
spiral bound notebook. And even tonight, what did you take away from this show? What did you take away from Ashley Vickers and Susan Mintz's show? I ask everybody to find something tonight. Start your writing journey tonight. And as a therapist, that should be one of the first things you tell them when you have your clients coming in. Tell
Hmm.
them, get a journal. The next time I see you, I want you to bring a spiral bound notebook and a pen because I want you to start writing your journal and your story out. Stories matter.
Hmm.
If I wasn't a story writer or a storyteller, how could I be so comfortable talking to people through gadgets that I have no clue about? And to people I still hardly know, and yet I know you. I know your heart. There are millions of us out there that want our stories told. Millions. And through you sharing this with people, you'll get someone to want to come on. And they'll get someone to want to come on. And before you know it, we will remove the face of HIV, which has no face. We'll remove the stigma, which is so horrible. But you make such a difference because you have chosen to give your service to the community. That's what makes it so positive. I want to say thank you, Ashley, again for a wonderful show.
Thank you.
And I look so forward to seeing you. And you have been watching, in between everything else, you have been watching Positively Positive. And we look forward to your stories. If you have one regarding HIV in any way, please send it to the phone number on your screen or contact me, Susan Mintz, at susanmintz.com. And please check out my books. They're a valuable resource. I will say shalom and God bless you, and thank you again for watching Positively Positive. And good night.
Good night.
I got my